Ventricular tachycardia is abnormal heartbeats that start in the bottom chamber, the main pumping chambers of the heart. Some of the symptoms of ventricular tachycardia include palpitations, the sense that their heart is skipping a beat. Other patients will have fatigue or shortness of breath because those extra heartbeats from the bottom part of the heart are not generating normal blood flow. That causes the chest pain, shortness of breath, low energy, or fatigue. There are two different types of the ventricular tachycardia that we deal with. The one subtype that is very concerning are folks who have had a heart attack in the past or have had congestive heart failure in the past, where that area of damaged heart muscle then begins to misfire. That can be potentially life-threatening, and so that's something that's very important to diagnose and to treat. A second subset are patients who have what we call normal heart ventricular tachycardia, meaning they have no evidence of other heart disease, but electrically they have areas in the bottom chamber of their heart that can misfire and cause a lot of problems for them, particularly related to palpitations, chest pain, or shortness of breath. The first test we do is a standard ECG or electrocardiogram to be able to assess the heart in general, but often patients will need heart monitors such as a Holter monitor or an event monitor that can record the heart rhythm over several days to even weeks to be able to make the diagnosis. For ventricular tachycardia, or PVCs, the premature ventricular contractions, there are medications that can slow the heart rhythm and try to suppress some of these extra heartbeats. If these medications are not effective, or if the medications cause side effects, they can then be referred to an electrophysiologist for an EP study, or an electrical study of the heart, and the ability to perform a cardiac ablation procedure where we actually will use radio energy to damage those extra circuits of tissue to be able to restore a normal heart rhythm. Cardiac ablation is not an open heart surgery. There's no cutting of the heart, there's no scalpel. We actually are able to approach the heart using special IV tubing that's placed in a vein or an artery in the thigh, the femoral artery and femoral vein. That enables us to get to the heart without the need for any open heart surgery, which makes the recovery faster, it makes the procedure safer. The majority of patients are able to get this procedure done on an outpatient basis and go home the same day with a very quick recovery. In patients with normal heart ventricular tachycardia or normal heart PVCs, the success rate is upwards of 90%, meaning with a single procedure, 90% chance that they'll be cured for good. The second subtype of patients who have other forms of heart disease, really the success of the procedure depends on how well we're able to control the underlying heart disease. So for example, if a patient has ventricular tachycardia due to an old area of a heart attack, really the goal after the successful procedure is to prevent further heart damage with medications and with changes in your lifestyle, a healthy lifestyle, to be able to prevent the arrhythmia from coming back. One of the technologies that has really revolutionized our ability to find and cure patients with these arrhythmias is 3D mapping. What 3D mapping does is the catheter has essentially a positional sensor that's able to track in 3 dimensions all of the different chambers of the heart to be able to localize where the abnormal heartbeats are coming from in 3 dimensions. That enables the electrophysiologist to deliver very pinpoint lesion to be able to destroy just that tissue that's beating abnormally. It makes the procedure safer because you avoid the normal heart tissue and lowers the risk of any side effect or complication from the procedure because it's so accurate. We're able to map these heartbeats to within a couple millimeters of accuracy. At Swedish Heart and Vascular Institute, we seek to offer care that is personalized and tailored to the individual patient. We offer a wide range of treatments that will provide the best degree of success for the patient, a high degree of safety for the patient, and also preserve their independence, get them cured of their arrhythmia, and get them back to being independent.